Thanks very much for having me here today. And last time we were here, we were doing a healthcare town hall meeting as well, and had a great turnout. This time we don't have the C-SPAN cameras here. It's just great. We're going to talk about how this bill. Have you heard about this healthcare bill? Yeah, nothing good. Look, for healthcare, we've been working on it for years. I know there are a lot of improvements we need to make, but I don't support this bill. I'm just not convinced bigger government means better health care. And the way, I don't think we can ever afford this. I think the Medicare cuts are dangerous, and the income tax increases are going to be damaging, and we're not going to have lower health care costs at the end of the day. Let me tell you about 5 things you may not know about this health care bill. And as you may remember, there's 2 bills with the President. Senate bill first, with all the special deals in it, and the reconciliation, the fix bill they call it. Second, let's talk a little about what they do together. One thing you may be surprised about is this bill may actually encourage businesses to drop their health care plans. Here's why. The whole premise of this bill is that every person in America has to have government-approved health care. And every company has to offer government-approved health care, or you may both face a fine. The tax really is what they have. If you are a business that offers health care to your workers, but it's not government approved, you face a fine of up to $3,000 for every employee. But if you don't offer it at all, you face a fine of $2,000. Think about that. If you're trying to help your workers get health care and you're paying for it, but it's just not deemed government approved, you pay more than if you just didn't offer it at all. And our worry is down the road, businesses are going to look at the bottom line. And they're going to decide, you know, healthcare is expensive. And it's just easier for us to drop it and pay that fine, have our employees go into those exchanges, than it is to keep it going. And that would be exactly the wrong thing we want to do. You're also seeing another worry along that line is you're already seeing companies that are announcing billions of dollars of new tax charges as a result of this bill. You may remember when we put the prescription drug plan together, 2003, we were worried about companies. A lot of companies were dropping the retirement health care plans for the retirees. I mean, it was just this line going down from 75% of companies had those plans to 70 to 65 and 60. So we said, if you will keep your retiree health plan, the federal government will pay 28% of your medicine costs, which was a big driver of the plan cost. So, and we did that for government plans, we did it for private plans. And it worked. It leveled off beautifully the last 7 years, stayed pretty constant. Well, in this bill for businesses, they take away a pretty good portion of that incentive to keep the plan. So much so we think businesses will have to it'll cost them about $14 billion going forward. The worry is that the slide will return, and we estimate some 6 million seniors may lose their private retirement plan because they lost that incentive. And by the way, that 28% incentive actually continues for government workers in their plans, and private workers not so much. So that worries us. Also, in this bill, when it comes to employers, this bill offers health tax incentives and tax credits for small businesses to provide health care. That's a good thing. But they wrote it so narrowly that the National Federation of Independent Businesses estimates that 90% of small business workers won't get any help through this bill. And they say it offers, you know, little or nothing in help for small businesses. One of the reasons is they drew it so narrowly. If you're a company with 25 workers or less, and you pay $25,000 or so, those tax credits actually will be helpful to you. But if you want to add that 26th to 27th to 28th worker, or you need to pay them more than $25,000, that help goes away pretty quickly. So we're worried at the end of the day, again, businesses are going to look at the bottom line and say, you know, we can't afford health care anymore, which is exactly, again, the wrong direction. Second thing you may not know is that health care premiums will likely go up for most of you as a result of this bill. Back to government approved. The mandates in this bill are enormous. and will drive up costs. Some of those mandates we all agree with. Covering people with pre-existing illnesses needs to be done. Raising the lifetime cap on medical insurance costs needs to be done. If you're a parent, you've got a child that has a cancer or a rare disease, very costly disease, guarantee you'll blow through that lifetime cap in a pretty good amount of time. That needs to happen. But there are a lot of mandates in this bill dealing with the appeals process, preventive care. They put in community rating, which doesn't mean much to most people, but what it means is young people and healthy people will pay more under this bill. When you get health insurance today, within your group, for example, younger and healthier workers, you get a discount because they're most likely not to use care. Community rating says, you know, people really ought to all pay the same amount. So they narrow the discount you get. So younger people, healthier people can pay more. Also, we are worried about cost shifting. As you know, especially our hospital board members know, that the hospital doctors lose money on every Medicaid patient who walks through the door, probably on most Medicare patients as well. And you know, you try where you can to make up those losses. And usually, if you can, on private pay patients or private plans, although a lot of them are pegged to Medicare anyway. But there's cost shifting that already occurs from the losses in the government program to private plans. Under this bill, the way they cover half of the 32 million Americans they now want to cover under this bill, new folks with insurance, is they just expand Medicaid, the one that pays about 60% of the cost of that health care. The worry is that more cost shifting is going to occur because they can't, doctors and hospitals can't make it up on volume when you're losing on every patient coming through the door. So the Congressional Budget Office estimates that an individual by 2016 will pay about $2,000 more a year for health care premiums than if this bill didn't exist at all. My thought is the whole goal of health care reform was to lower health care, make it more affordable, so fewer people were uninsured, more small businesses could cover people. We're going the wrong direction. And one of the ways we know that's likely to happen is Massachusetts. 2006, Massachusetts passed a very similar bill to this. So it's been up and running. It took a year to implement. It's been up and running about 3.5 years. The good news is they cover 97% of the people in Massachusetts now have health care plans. The problem is it comes with a very steep price. They now have the highest insurance premiums in the country. They spend 33% more per patient than they did before, so it doesn't control health care costs. It's been driving. Doctors are overloaded, so the average time to see a doctor on a routine visit is now over 3 months. Half of doctors do not take new patients. They're overloaded. MassCare, which is their government-run plan, because they are starting to struggle financially, now deny 4 times as many claims as the private plans in Massachusetts. And because they're starting to run out of money already, they start cutting reimbursements. Hospitals first, then they started withdrawing benefits from certain population groups. They started with legal immigrants, but they're going to have to do more. So 3.5 years, they have higher healthcare costs, slower healthcare delivery, and they're starting to ration care. That's what all of us have been worried about as they put this plan together, is that was what would happen in this. And that's, I'm afraid, where we're headed. Third point, meet Uncle Sam, MD. The federal government, and the IRS especially, is going to be deeper into your life than ever before. They have in this bill, in addition to the mandates, 15 new tax increases, totaling $569 billion. They touch most Americans in some way. New taxes on insurance plans, on Cadillac insurance plans, on medical devices, everything this hospital buys, from bedpans to masks to syringes to flu shots to everything else, will have a new tax on. New tax on medicine, new tax for small businesses and professionals making over $200,000 a year. Higher Medicare taxes, a brand new tax on investment income. New taxes on tanning salons you've heard about. Health savings accounts are limited. The individual medical deduction is a tax increase. So to enforce all those new mandates and taxes, they estimate the IRS will have to hire 16,000 new federal agents. Well, one, it's the largest expansion of the IRS since withholding started in World War II. Now, when most of us thought about health care reform, we imagined more doctor's exams, not more IRS exams. And if we need 16,000 more of anything in America, we need 16,000 more doctors and nurses. We already faced a huge shortfall. Physicians, 40,000. We're short over the next decade. Nurses, 4 times that many over the next decade. That's where our focus ought to be. And already, we're worried about what the impact of this bill will be. In our district, we've had 2 constituents contact us where their doctor of choice for many years has decided in the last 2 weeks to convert to a boutique practice. Where in effect, this one woman showed us the proposal. They're going to limit it to their practice clinic, I guess, 600 patients total. Each for those who pay $1,500, you're one of those. And you know that probably will work for that practice, but we can't have that in all of America. People can't afford those extra costs. So we're very worried. Also, you've seen the new surveys. 46% in one survey, 46% of doctors said they would consider leaving practice. I hope it is nowhere near that because we can't afford, frankly, to even lose one at this point. Seniors, many seniors are going to lose their Medicare Advantage plan. Most seniors will see their prescription drug prices go up. Here's why. Medicare Advantage, well, this bill has more than $500 billion in cuts to Medicare. A big portion of it to Medicare Advantage. The second biggest portion to inpatient and outpatient hospital services. But beyond that goes home health care, hospice, nursing home, dialysis, on and on and on. More than $500 billion. It's going to have a big impact. But they cut Medicare Advantage. Medicare Advantage was a plan created again about 6 years ago, designed for rural communities and minority communities that didn't have lots of health care to it. So the government agreed to pay a bump to companies. They would put plans that would put together doctors, hospitals, preventative services for seniors, and medicines, all in one package. They proved to be very popular. In Texas, we have, I think I've mentioned before, 1 million seniors on Medicare Advantage. Not all of them are good plans, but a number of them are pretty solid in our platform. In this bill, because they're slashed, 1 out of 3 Texas seniors will be forced out of their Medicare Advantage plan, and those keeping them will pay about $816 a year more, to keep. That's probably what most seniors didn't think about when they heard health care. The other thing is, the president has announced that they are closing the donut hole and lowering drug prices for seniors. But the law doesn't really read that. You may remember when we put the prescription drug plan together, we did it through Ways and Means Committee I serve on. We worked 3 years on it. Not a perfect plan, but I still believe and still support it because I think I would rather spend a dime in medicine today to keep a senior healthy than to spend $1 later when they have a surgery or a illness or come back to the hospital and we could have prevented it. The way we designed it, we looked at seniors sort of 3 groups. We knew that 90% of seniors would spend about $2,000, $2,100 a year on their medicines. So we put together plans like an insurance plan with monthly premiums, co-pays, and deductibles. And that covers 90% of seniors. We then skipped over to those 6 seniors out of 100 who contract a disease or combination of illnesses whose medicines are so expensive they can never afford it. The old $1,000 bill, $20,000 a month paying, literally no one. And so we put a catastrophic plan in place. And to make sure no senior would ever lose everything they worked their life for, to pay for medicine, and that's worked. In between is roughly about 10% of seniors. and they hit what people later called the donut hole. But it was an area where they were responsible for their medicine. After the 90% of seniors were covered here, a small group was catastrophic. There was left, roughly, there's some overlap, about 10%. And to help seniors through that period, through that donut hole, we created options. Like in Texas, we have 11 different plans, options for seniors to cover them all the way through the donut hole. Some of them are the basic Ford plans, some of the Cadillac plans, but you have choice. Under this bill, they don't close the donut hole. They constrict it for 6 years. It bounces back. They got some discounts from the drug companies for seniors and their brand drugs in that area. But for the most part, to finance the health, they're going to raise the premiums on the 9% of seniors who never will reach the donut hole. That's a lot of the basis of this bill. Raise prices on those who have health care to pay for those who don't, rather than focusing on lowering. As a result, most seniors will see about a 9% increase in their Part D premiums on top of what we already expect for increases. Again, going the wrong direction. Final point. A lot of questions about this bill, and for good reason. As I told you, there's two bills. The Senate bill, you may remember, was negotiated over Christmas time. They had all those special deals. Hey, Mayor, how are you doing? Well, all those special deals for Nebraska, Louisiana, all that. It was never intended to become law, so it was written very sloppily. They thought it was going back to the House to be voted on and worked out the differences. So they have provisions that conflict each other directly. They have other provisions that are so vague you can't tell what they're trying to do. And some parts of it remind me of my 5th grader who I've noticed will work on his homework and scribble it as he's going into the classroom to get it on the teacher's table on the desk on time. Very poorly written. That's now the law plan. And the reconciliation bill to fix all this is based on the Senate bill. So we're discovering each day new things that are in there, in problems. For example, in that list, it's all back to government-approved health care. They had to, in this bill, outline, so what is government-approved health care? And so they said it's Medicaid, it's Medicare, it's children's insurance, but they forgot 2 groups. Our military in their TRICARE plan and our veterans in their VA plan. So the way they wrote it, we would have a military and a VA who actually would face a fine because they didn't have the right health care. Well, that's ridiculous. They tried to fix it twice. Before Easter, they tried to fix it the last time, and they fixed the TRICARE, the military side, but they only fixed a part of the VA. They left off the soldiers who were being treated for Agent Orange, spina bifida, issues like that. The American Legion and Veterans of Foreign War came out of their seats, and one they called it literally an act of betrayal. And they said, please, slow down. If you don't know the damage you're doing to people by rushing this through, please get it right first. We are going to correct that problem. There's no question about it. We're going to see more and more of that in this bill. In fact, the President, the first day he signed it, he said, from this day forward, children with pre-existing illnesses will now be fully covered. He meant it. He was sincere. It's what he believed. The problem is, the bill didn't say that. It doesn't require companies to cover those with pre-existing illnesses, children, and if they do, they have until 2014 to do it. Well, 2 days later, the Health and Human Services Secretary said, well, don't worry. We'll write the rules and regulations to make that happen because we know that's what Congress intended. Our worry is that agencies are going to be interpreting what Congress intended in a number of healthcare issues where, as we already know, from Medicare and MedPAC, we know some of their decisions that the agencies make that are nonsensical and have no idea of how healthcare is delivered here in Livingston. The one area, and I will absolutely finish with this, is where I have no question at all about this bill, is that I don't believe we can ever hope to pay for it. It's $2.5 trillion, of spending just in the first 10 years. It really ramps up. It runs a huge deficit. I say this because the Congressional Budget Office said, you know, this runs a small surplus the first 10 years and then a little more after that. But they also said, and by the way, we're only estimating the bill that is in front of us. So we are counting the budget gimmicks, the timing gimmicks, and the doctor reimbursement solution for Medicare is not in here. Those should be in here, but since they're not, we'll only count what we're looking at. What that means is they left out a number of expenses that go with health care reform to try to make the bill look like it's balanced. They left out the $200 billion or so solution to finally reimburse doctors fairly for Medicare, which everyone agrees needs to be done. That used to be in the bill, but they wanted it to look smaller, so they took it out. They put it out this time. And now the reimbursements have been cut 21% as of April 1st. You know, they're holding the payment claims, but it's just a mess. It's going to cause more damage. When we go back, they're going to do a month-long Band-Aid, and then they haven't figured out if they're going to extend reimbursements for 1 year, 2 year, 3 year, 4, or longer. So now we have, Doctor, you may want to talk about that in a minute, about petitions that we need signed to make sure Congress actually deals with it. But they took the Medicare cuts, $500 billion in the bill, and they counted it twice. Congressional Budget Office says your law counts it twice. One, to strengthen Medicare, and the second time to pay for the bill. They took revenues coming from Social Security, applied it to the bill, not to Social Security because you're going to have to pay those later. They took a new plan. There's a health care plan called CLASS Act, C-L-A-S-S, CLASS. It's long-term health care. And the way it works is people paying premiums, at least 5 years worth. But when they get elderly and need long-term care, they'll get that covered for them. So it's almost like an insurance plan. They took the $70 billion for the first 10 years in premiums, and they applied it to this bill, ignoring the fact that, you know, someday you'll actually have to pay for the benefits that you just paid in for as a result of all the timing and the budget gimmicks. This runs a deficit in the first 10 years of $660 billion. On top of Medicare, which is close to insolvent. On top of Social Security, which paid out more this year than it took in. And on top of, we are running as a nation $1 trillion debts. Last year, deficits last year, this year, next year. In fact, if the president's budget goes through, for the next 10 years, we'll run a $1 trillion deficit every year, to the point where we will owe as much as a nation as our entire economy. Since last year, each and every one of us owed $56,000 of the national debt per person. At the end of this decade, we'll all owe $107,000 per person. Moody's is threatening to reduce the credit rating of the United States. We're being lectured by China and France and others. We're really getting to an unsustainable debt in deficit, and this is added on top of it. That's what keeps me, of everything we're doing, keeps me awake the most at night. It's the spending we're on, because I guarantee you can't tax your way out of it. We could double everyone's taxes in this room, and in America, we'd still be running debt. I mean, can you imagine in your own life spending 50% more than you take in every month of every year and do it for a decade? And imagine where you'd be at the end. That's sort of where we're at. So spending does matter. So David, with that very cheery news on a Friday afternoon, thank God it's Friday. Can we stop and take some questions or comments?
Absolutely. Thanks.